Okay, good evening. My name is Rita Onyinyechukwumanafa, and today we're going to be talking about some signs of high blood pressure that you must never ignore. Okay, and we're also going to be talking about some other things like you experiencing fluctuations in your blood pressure, you having ringing ears, and also how you can reduce your blood pressure in minutes. Okay, so let's get straight into it. Now, your readings. First, I want to talk about readings. It's when we understand our readings that we can understand why our blood pressure fluctuates. Okay, now in this slide we have some healthy normal readings. Okay, so an optimal BP reading would be less than 120 for your systolic and less than 80 for your diastolic. Okay, and I'm sorry to interrupt, but if at any point you cannot hear me or you can't see my screen moving, please let me know, okay, using the chat. So I want you to recall all the times that you have taken your readings before, okay? An optimal reading is 120 or less than 120 for systolic and less than 80 for diastolic. Now, a normal reading would be between 120 to 129 for systolic and between 80 to 84 for your diastolic, okay? And what we consider a high normal reading would be from 130 to 139 for your systolic and from 85 to 89 for your diastolic. Some of you whose readings are already in 130 and are on medications, you are not supposed to be on those medications because you are not a hypertensive patient, okay? So if your blood pressure ranges from 110 to 139, you are a normal human being. There is absolutely nothing wrong with you. You're not a hypertensive patient, okay? So what is the reading of a hypertensive patient? We have, first off, grade 1, okay? Now, in grade 1, we have 140 to 159 for systolic, okay? And we have 90 to 99 for diastolic. Now, at this point in grade 1, you are not supposed to freak out, okay? Because a reading of 140 to 159, there is no evidence of it being able to kill you, okay, or for you to develop a stroke or a cardiovascular disease. Now, that doesn't mean that it's a good reading. You should do, you should look at your lifestyle, look at your health, look at your diets to see what you can change to reduce your blood pressure. But a reading of 140 to 159, there is no evidence that this reading is a harmful reading for a hypertensive patient. So at this point, if you are on 140 to 159, your first, the first thing you do is not to start looking for which medications to take to bring it down. You should first off focus on your lifestyle and your stress, your diet, your exercise. Think about those things, okay? Now, when you enter grade 2 hypertension, okay, that's when you are in stage 2. You have 160 to 179 for your systolic, 100 to 109 for your diastolic. Now, this is where it's a very, very big problem, okay? This is where you are at major risk of developing a stroke, a heart disease, or a kidney failure, okay, in your grade 2. Now, if it's above 180 for your systolic and 109 for your diastolic, this is what we call a hypertensive crisis. You are a walking corpse, okay, if you so happen to have a reading above 180 for your systolic and 109 for your diastolic. So at that point, it's a medical emergency. If you ever have anyone with a reading of above 180, that person is at major risk and the person should be taken to the hospital immediately. Okay. Now let's move on. Is a fluctuating BP normal? The simple answer is yes. As a human being, there is no way you are going to have a stable blood pressure for the rest of your life. Your readings are not going to be 120/80 up until you die. It's not possible because your blood pressure, it meets the condition of your body at every moment. For instance, when you are lying down, you would have a lower BP lying down than when you get up. The reason is, as you are lying down between your heart and your brain, your blood is able to flow easily because it's not fighting against gravity. Okay, there is less friction. You are lying down. The space, or should I say, the distance between your brain and your heart is not very long when you are lying down. But when you stand up, okay, your blood has to fight against gravity, has to push up. That is taking blood back to your heart and then to your brain as well. That's fighting against gravity, right? Moving upward. So your BP is going to rise. It explains why you have a lower blood pressure while you are sleeping. And when you wake up in the morning, if you check your blood pressure, it can increase. Your body is just simply adjusting, okay? Because someone messaged me, she asked me, when I wake up in the morning, my BP is higher than when I go to bed. It's very, very normal, okay? Simply because of what I just explained. Sometimes friction as well, because your red blood cells are trying to move through your blood vessels, right? So there's going to be a little friction. It's just like you are rubbing two things against each other, okay? There's going to be a little friction, right? So your blood pressure, as you are sitting, as you are lying down, as you are sleeping, as you are standing, as you are walking, as you are eating, whatever it is, it's going to fluctuate. It's going to meet the conditions of your body requirements at every given time. So please don't expect to have a reading in the morning and also have the same reading at night. Imagine if you go about the stress of the day just being a Nigerian 9-to-5 worker, okay? Don't expect that after all the stress of the day, your BP would still be reading what it's read in the morning, okay? So you having a fluctuating BP, it doesn't mean that there is something wrong with you. There is absolutely nothing, okay, wrong with you. So your blood pressure has to fight against friction and gravity, okay? And if at any point you have a higher blood pressure, it just means that you need blood and you need more oxygen at that particular time. And you also need blood at a faster rate, okay? It's just like when you are exercising. Your body knows, okay, we are using more oxygen, so we have to give you more, okay? And what happens? Your BP is going to increase so that you can produce, much oxygen. When you are under stress, your BP is also going to increase to give your body more oxygen so that you can tackle the stress, you can tackle whatever it is that's stressing you out, okay? So you having a fluctuating BP is totally okay, totally normal, okay? So let's move on. There are some causes. I want to remind us of causes of high blood pressure. We have the primary hypertension due to things that you can control, okay? Your environment, your lifestyle, your diet, how often you exercise, your stress level, etc. Okay, and all these things I mentioned can be divided into two things. Either you have insulin resistance or you have plaque formation, okay? Now, secondary hypertension is hypertension due to a medical condition. For instance, if you suffer from a kidney disease or a renal disease and it causes your blood pressure to rise, then that's a secondary hypertension, meaning that if you treat that medical condition, your blood pressure reduces, right? Now, when we come back to the primary hypertension, we can also divide primary hypertension into two, okay? We have your metabolic imbalances, things that are going to cause you to be either nutritionally deficient or result in insulin resistance or plaque formation. And we also have neurological. This is basically, if I shorten everything I wrote down on my slides, is stress, okay? Now, if you walk into a room, let's take, for instance, you come back home from work, okay? And you are tired, you just want to sit down on your bed, and you enter your room, the first thing you see is a lion. You're going to scream, right? What's that? And your sympathetic nervous system, which is the part of your brain that controls either you run or you fight, we call it fight or flight, okay? It's going to dominate. So you have a choice. You have to make a choice there and then to either close the door, run away, or to fight the lion if you can, okay? Now, the same thing happens when you are under stress, especially when you are under emotional stress, okay? Your sympathetic nervous system, what controls if you flight or if you fight, would be dominant, okay? And when that happens, your body needs more oxygen. Now, if we go back to our example of entering your room and seeing a lion, your heart is going to be beating so fast, right? You'd be so scared. What exactly is a lion doing in my bedroom? Okay. So for your heart to beat that fast, it means that you need more oxygen. You also need more energy, right? To either run away or to leave the room, right? Or to fight the lion, I mean. So your body has to then produce more oxygen. So when you see that lion, what happens is your sympathetic nervous system has to signal your body, hey, we need more oxygen. We need more energy. Also, increase the pressure within our blood vessels so that blood can get through every single part of our body, our hands, our legs, just so that we can move, okay? Because some people, when you have a shock like that, they're like frozen, they're frozen to death, right? So your body your brain has to signal your entire body to get moving, okay? So that increases your oxygen requirements, increases your glucose, and also your blood pressure as well. Now, if you are under neurological, emotional stress, this can cause your blood pressure to increase over time, especially people who are dealing with things like anxiety. Some people, you eat very well, you are so healthy, yet you are hypertensive. Try to look at your stress level, your neurological and your emotional stress, okay? That can also play a role in your blood pressure, how high your BP is, especially if you are under such stress chronically, every day, day in, day out. You are just so stressed out. Definitely, you develop hypertension from that. Your body will just put itself in that fight or flight stage, okay, until you actually do something about it, okay? So I just want to remind us of some of the causes of high blood pressure, okay? Please give me feedback. Are we together? Can you hear me? Are we following? Okay. So let's now discuss some signs of high blood pressure that we should never ignore, okay? So the first is severe headache. And I'm not talking about the headache that you get day in, day out. I'm talking about severe headache. You feel a sharp pain in your head, as if someone threw a very sharp knife into your brain, okay? So very, very severe pain, and it cannot be fixed with Panadol, your paracetamol, your aspirin, medications that you take whenever you have headaches, okay? And you get this kind of headache when you are in a hypertensive crisis, okay? So if we want to remind ourselves of what a hypertensive crisis is, it's a grade 3 hypertension. So your readings are above 180 for your systolic and 109 for your diastolic. Okay. So severe headache, definitely something that you want to go to the hospital to check out. Okay. Especially if you take your BP readings and they are very high, above that 180. Okay. Now, the next thing is your nosebleed. So you bleeding due to high blood pressure is very, very rare. You having a nosebleed due to high blood pressure is very rare. It would be caused by vitamin C deficiency, usually. Okay. If someone is not hypertensive, what will cause their nose to bleed is basically vitamin C deficiency. But if you are to experience a nosebleed as a hypertensive patient, it would happen if you are in a hypertensive crisis and you do not know, to the point where there is so much pressure within your blood vessels, and some blood vessels that are so tiny and that supply some parts like your eye, your kidney, it's going to leak. Okay, the friction within that, the pressure and the friction within that blood vessel is going to cause that blood vessel to leak. And then, you would experience things like a nosebleed. Okay. The next thing is your blurry vision. Now, blurry vision is not also something that high blood pressure or a slight increase in high blood pressure would cause, but something like diabetes or your insulin resistance would cause you to have a blurry vision. Okay. So your nosebleed, your blurry vision, your severe headache as well. Okay. The next thing is blood in your urine. Okay. Now, again, a slight increase in your blood pressure would not cause you to have blood in your urine. Okay. If you experience blood in your urine, it's most likely due to a urinary tract infection. Okay. However, it is very possible that you can be in a hypertensive crisis and you do not know, and tiny blood vessels that supply places like your eye and your kidney, like I've said before, the friction and the pressure within those tiny blood vessels would cause those blood vessels to leak. Okay. Now, the next sign is fatigue and shortness of breath. Now, somebody who is in grade 1 or grade 2 high blood pressure would not really experience fatigue and shortness of breath, except if it's a side effect of your medication. Okay. However, there is a special kind of high blood pressure. We call it pulmonary high blood pressure. And I want you to please listen attentively, because I do not have text. I'm simply going to explain this, using my cursor. Okay. So over here, we have your heart. Now, your veins carry blood back into your heart. This is the left side and this is the right side. Okay. Now, when the blood comes back from your brain and also from here, from your arms, your legs, every other place, back into your right ventricle, okay? What happens is that blood is going to be pumped back to your lungs so that it can get oxygen from your lungs, okay? Now, if in a situation where something is wrong with your lungs and you have a pulmonary edema, which is swelling of the lungs, or you happen to have water in your lungs. Now, we have to ask the question, what would cause someone to have water in their lungs? Your improper lifestyle habits and choices would cause you to develop something like a pulmonary edema or water in your lungs. For instance, insulin resistance, diabetes, okay, can cause a human being to have something like that. Now, when there is water in your lungs and the right ventricle of your heart, this part is trying to push blood into your lungs, but because of the water, it's unable to do that. And your heart detects that something is not right somewhere. It's going to start doing a lot more work than usual, right? Just to try and get some blood oxygenated, okay? Now, in that case, when we have your heart trying to pump blood into the lungs that's has some water in it, we call that pulmonary high blood pressure. Okay. And then that right side of your heart can get overworked. Okay. Also, if you don't have enough oxygen getting into the blood, that is, if this right side of your heart keeps pumping blood, and because of the water in the lungs, oxygen is not able to, oxygenate your blood enough. And, the blood gets back into your left ventricle and then supplies the rest of your body. Okay. It's going to cause you to be fatigued and to have shortness of breath. Why? Because there is something wrong with your lungs. You have pulmonary edema, and your heart is trying to pump enough blood into your lungs. It's not working out because the lungs are also slightly damaged. Enough oxygen is not getting into the blood as well. You as a human being, you are going to get fatigued and you're going to be out of breath. Okay. So pulmonary edema can cause someone to have what we call pulmonary high blood pressure. And you can have pulmonary high blood pressure without even being a hypertensive patient. Okay. So you can have pulmonary high blood pressure without having peripheral high blood pressure. So the high blood pressure as we know it now, okay, you calculating your readings, it's 160, 180 and above, that's peripheral. Pulmonary high blood pressure is independent. So somebody can be hypertensive and have pulmonary high blood pressure, and they can also not be a hypertensive patient and still have pulmonary high blood pressure. Now, some of you also complain that the right side of your heart is enlarged, or when you go to the hospital, you do an ECG or an EKG, and the doctor detects that the right side of your heart is enlarged or the left side of your heart is enlarged. This is one of the situations, that will cause either parts of your heart to be larger than normal. So in this case, we are going to have the right side of your heart, because it's the right side of your heart that is pumping blood and that is working harder than usual, right? So over time, the right side of this patient's heart can get enlarged, okay? And if there's a situation where it's the left ventricle that's not getting enough supply from the lungs, then it's going to be the left side of the heart that is enlarged, okay? So I really hope that we understand. Okay, I'm just saying the charts. Okay, I'm just saying the charts. I'm sorry. Okay, let me try sharing again. I didn't know my screen was frozen. Okay, so can you see my screen now? Hi, everyone. Can you see my screen? And can you also hear me? Okay. So I hope that you understood what I was trying to say, but let me just recap. Okay. So I was explaining that when blood gets in from your brain, and also from every other part of your body into this right ventricle, it pumps blood into your lungs so that it can get oxygenated. Okay. Now, if there's a situation where someone is not living a very healthy life and water gets into this lung, okay, and the right side of the heart is trying to pump blood into this lung, but because of the water in the lung, blood is unable to get through, and also blood is unable to be oxygenated, okay? So what happens is, because you don't have enough oxygen in your blood as you are supposed to have, you become fatigued, you become very weak, and you also become out of breath, okay? And I also explained that it's a situation like this that would cause either the right side of the heart to be enlarged because the right side of your heart is going to start doing more work, okay, now to get blood, through your lungs so that you can have blood, moving through your entire system, okay? So when the right side of your heart is trying to pump blood, but then because of the water in the lungs, blood is not really getting through. And because blood is not getting through, oxygen is not also, getting into your blood. So you are out of breath, you are very weak, and this part of your heart can also get enlarged, okay? Because usually when I get on calls, people tell me, I went to the doctor and he said, the right side of my heart is enlarged. It's a situation like this that can cause either part of someone's heart to be enlarged, okay? So I hope that we understand, okay? Now let's talk about tinnitus. Tinnitus is ringing in the ear. Now, remember I said that as blood is trying to move through your blood vessels, there can be some form of friction, okay? And it's because of that friction that you have something called a blood pressure to push the blood through your blood vessel, okay? Now, sometimes, just like you have heart palpitations simply means that you are aware of your own heartbeat, which you're not supposed to be aware of your own heartbeat, right? So if you are a hypertensive patient and you are aware of your own heartbeats, there isn't necessarily anything wrong with you, okay? You are just aware that, hey, I have a heart and it's pumping, okay? Now, if you are a hypertensive patient and you can hear the friction of your blood cells moving through those blood vessels, sometimes you would hear it in your ears. That's that humming sound. It's usually like, or it's like a hissing sound, okay? Either of the two, the hissing sound is more common than the humming sound, but it is simply because of that friction in your blood vessel. Because you have a high blood pressure, your body usually tends to adjust to that high blood pressure, okay? So what happens is, if you do have that friction, sometimes you would be aware of it. That's what is ringing in your ears. Now, it's very, very similar to your palpitations. And I've spoken about palpitations before, but if you do have palpitations, there is nothing wrong with you, especially if you are on antihypertensive medications, okay? I also gave instances to know if your palpitation is something that you should go to the doctor for. For instance, if they last longer than usual, if they last over 30 minutes, if they are very sudden, if they are very also severe, that is, if you can literally hear your heart pounding over and over and over again, and you go to the hospital, you can go to the hospital for that, okay? So please go back to my palpitations. It was a slide. I sent them to all the groups, okay? And if you want me to send them again to the groups, just let me know, okay? But focusing on tinnitus, ringing in your ear, it's simply because of that friction, blood simply trying to move through your blood vessel, okay? Just as sometimes you would be aware of your own heartbeats, sometimes you would be aware of that friction as well, okay? Now, the humming side is majorly due to friction. However, that hissing sound usually detects, or should I say, it states that you are under a lot of stress, okay? And you should watch your stress level, especially your emotional and your neurological stress, okay? Now, tinnitus is not something that would harm you. It doesn't have the potential to harm you. However, if it's bothering you so much, you can see your doctor about it, okay? Especially when you start experiencing tinnitus for the first time after you've had like a respiratory problem, okay? Then it's something that you should talk to your doctor about. However, if it's not bothering you, if you just hear it sometimes in your ear, there is nothing wrong with you, okay? So take a look at your emotional stress, your physical stress, your neurological stress. That would be the reason for that hissing sound, like that would be the reason for that. And if you have the humming sound, the then that is due to friction in your blood vessels, and there is nothing wrong with that. You are just aware of that movement, okay? Usually it wears within a matter of seconds or minutes, okay? So we also have localized weakness. Now, if you are in a hypertensive crisis and you do not know, your body can fail you. Okay, you will be so paralyzed in your limbs, your hands and your legs. You can also experience facial drooping. Okay, and you can lose the ability to speak. So that is localized weakness. And your facial drooping, your weakness, your loss of ability to speak, all these things are also signs of stroke. And remember, I said your dangerous readings is from your grade 2. Okay, so it's a medical emergency. You should get that checked out. Okay, if you ever experience weakness in any side of your body, left side, right side, whatever it is, or you experience facial drooping at any point in time, it's a very serious thing. Okay, sometimes if it's a TIA, I don't know if you remember my previous talk, we talked about detecting early signs of stroke. Okay, sometimes some of you experience these things, and because they don't last very long, you just shrug it off. Please, it's not something that you should shrug off, because that's like a warning sign for you. Okay, especially if you have high plaque, okay, or you are dealing with atherosclerosis. That's basically a plaque in your blood vessel. Okay, it's a warning to you. So please, if you've ever experienced weakness in any part of your limbs, or facial drooping, or you can't speak at any point in time, please go to the doctor. Okay, and also check your blood pressure. Okay, so we have severe chest pain or angina, and I also gave I've spoken about chest pain in the past. I also put it to the groups in form of slides. Okay, so your chest pain, you should see the doctor if it's severe. Okay, if it lasts more than 20 minutes, if you are experiencing chest pain and you feel like you want to vomit, or you want to faint, or you are just not yourself, it's something that you should check out, that you should go to the doctor for, especially if it comes unexpectedly when you are at rest, and if it comes and you are a bit sweaty. Okay, so aside that, your chest pain, it's not normal. Okay, but as a hypertensive patient, because your heart is doing more work, you can experience a slight discomfort in your chest. Okay, so if you have a very severe heart pain or chest pain, okay, that lasts more than 20 minutes and it's very, very sharp, you would rate the pain about 6/10, then you should see your doctor about it. Okay, so 9 and 10, we have dizziness, confusion, anxiety. So remember the explanation I gave on your pulmonary high blood pressure? That is your right side of your heart trying to pump blood into your lungs, but because your lungs are full of water, your blood is not being oxygenated, neither is blood getting into the lungs. All these things can cause you to be nauseous, to be confused, and to also be anxious as well. Okay, so from all of these signs I've mentioned, there are some key things I want you to take out. The first is your stress level, okay, and the other thing is your oxygen supply. So please check yourself, be self-aware if you are ever running out of oxygen, or if you are fatigued, or if you are out of breath at any point in time. Okay, and your pulmonary high blood pressure as well, which is very independent in itself. Pulmonary high blood pressure would not show itself as a regular high blood pressure. You would only get to know about it when you have an enlarged heart that has already gone into congestive heart disease. Okay, so for you to be on the safer side, be self-aware when something is not right with you. Don't shrug things off and say, oh, it's nothing. Okay, except if it's your palpitations, or if you're having ringing in your ears and they don't last very long. Okay, so I hope that we get the gist of what I am trying to pass. I'd like some feedback from you. Are we together? Before I go into the next section of the class, that is reducing your blood pressure in minutes, please let me know. Are we together? Do you understand what I'm trying to explain? Okay, thank you so much. All right, so let's talk about reducing your BP in minutes. Now, if you are in grade 1, grade 2, grade 3 high blood pressure, which is a hypertensive crisis, many of you are already on medications, okay? I would not say that you should stop your medications, but some of you that are on medications are not supposed to be on medications. And once you start taking antihypertensive medications, it's very hard for you to get off them. Okay, so if you are not yet on your medications, there are certain ways that you can reduce your BP in minutes. And even if you are on medications already, when you have that fluctuating BP that makes you so anxious, that will cause you to pick your phone and call Rita. Rita, my BP was 120 this morning, now it's 160. What do I do? First, relax, okay? And follow the steps I'm going to show you now to try and reduce your BP in minutes, and then check your reading again, okay? Now, I can't turn my camera on because my camera is broken. So I put this image here, and I hope that you would be able to understand, okay? So you put your arm in this position, like at a 90-degree position, okay? And you can see this point here. It's in between this line and this point, this elbow point, okay? You can see where this man is touching that particular point. So you have to massage that part for about 1 minute, okay? Please make sure that you are relaxed, okay? So doing this for about 1 minute, it should not be so discomforting to the point where it's painful, okay? But you should feel a little discomfort, okay? So you massage this particular area for about 1 minute, okay? And then you can also do some deep breathing exercises. So you have to sit up straight on a chair, okay? And you have to be very, very, very relaxed, okay? And you deep inhale for 4 seconds. So for the entire 4 seconds, you are inhaling, okay? So you take it slowly. You inhale for 4 seconds, you keep inhaling. Then you hold it for 7 seconds. And you exhale slowly for 8 seconds, okay? Now you do this deep breathing for 2 to 5 minutes, okay? And then you check your BP again to see what the reading is. Usually, most times it's going to reduce, okay? So before you start to panic, you know, if you have a reading that jumped, try this acupressure. And when you are done with the acupressure, you do some deep breathing exercises, and then you take your blood pressure readings again. Deep breathing is something I would actually recommend that you don't do just when you have a spike in your blood pressure. You can do it every single day before you go to bed. When you wake up in the morning, it would help you, especially those of you that are very, very, very stressed out. Nigeria gets harder and harder and harder by the day. So if you are stressed out most of the time, you can do this when you wake up. Probably at midday, you do it again. Nighttime, you do it again. Let it be a habit, okay, for you. So remember 4, 7, 8. Inhale for 4 seconds, you hold for 7, and you exhale for 8, okay? 4, 7, 8. So that you don't have to come back to so you don't have to come back to this lecture to see this. Just remember 4, 7, 8, okay? Inhale deeply for 4 seconds, you hold for 7, and you exhale for 8 seconds, okay? And that wraps up our session for today. So we've talked about lowering your BP in minutes. We've talked about some signs that you shouldn't ignore. Okay, we have talked about fluctuations in your BP, causes of high blood pressure, types of primary hypertension, and your readings as well. Your readings, I know so many of you are very, very particular about your readings. Immediately your BP readings go, even if it's a step, even if it's a step above 129, it's a problem for you. Please calm down, okay? If you are very good in lowering your blood pressure and you are between 139 to less than 120, and you ever have a fluctuation, please don't panic, okay? you are okay. You would not have a stable blood pressure for the rest of your life. Okay? Different things happen to you. You work, you eat, you sleep, you jog, you move about, you exercise, different things. Okay? So if your BP ever fluctuates, come back to this. Okay? I remember Rita says that you shouldn't panic. So you do your deep breathing and your acupressure, and you should be good to go. Okay? And I know that some of you are also doing very well when it comes to treating yourself and making sure that your BP is optimal. So don't lose hope, okay? One step at a time. So we are done for today. Thank you so much for joining me. I would take questions for 10 minutes and then I would end the session. So if you don't have any questions, you can wait to hear other people's questions. And if you'd like to leave, you can leave. Thank you to the 33 of you that are here and stay to the end. I appreciate your presence. Please ask me your questions now. You're welcome. Thank you for being here. Any questions, please? You're welcome. Oh, there's a question up. I didn't see it. So let me scroll up. Okay, I can see it now. What are the implications if stage 1 diastolic is higher than systolic or vice versa? Usually, I like to focus on your systolic because they matter more. Okay. Now, your systolic is when you inhale and then blood, refills back into your heart. Your diastolic is when you exhale. Okay. So your diastolic, having a high or a lower diastolic would not really mean much because that is indicating that blood is, supplying every other part of your body. And from what we've learned today, so many different things would cause, your blood pressure to fluctuate. And that means that so many different things would cause you to need blood in certain parts of your body at any point in time. Okay. So lower or higher diastolics, they are not really a problem. Okay. There would never be a perfect reading and people would never have perfect readings. Okay. So usually your systolic matters more. That's not to say that your diastolic is meaningless, okay, or that it doesn't matter at all. Okay. But if at any point you have a higher diastolic than the grade 1 reading, let's say for your grade 1, your reading is 145. Okay, that's grade 1 systolic. And then you have a grade 2 diastolic. You shouldn't panic. Okay, it doesn't mean that there's anything wrong with you. So just remember that if your diastolic is either lower or higher than usual or higher than that particular grade, then it simply means that your blood is supplying different parts of your body at a faster rate. Okay, so meaning that that particular organ needed blood faster than normal. Okay, so usually your body would rectify itself if you have a lower or higher diastolic reading. Okay, so I hope that I've been able to answer your question. I hope I've been able to answer your question, Mr. Olutunde Amusan. Okay. If one is on medication and you have 128/70, can you stop? You getting off your antihypertensive medications is a process. I wouldn't recommend that you are off your medication simply because you have a good reading at a particular time. Okay. If you have been having 128/70 over a period of like 3 months, then definitely you can reduce your dosage and you can also get off your medications, but not without your doctor's notice. Okay. The reason it's not good for a hypertensive patient, it's not good for you to just get off your medications just like that, because your high blood pressure can come back. You can have a rebound. Okay. So getting off your medications is a process. You have to be very, very patient with yourself, and you also have to monitor your body. And I would also recommend that if you're getting off your medications, you also have something to support you. Okay. Because your high blood pressure is not something that developed within 2 weeks or months. It's decades of problems that we are trying to solve. Okay. So if you are going to get off your medications, patience, also monitoring your body. Okay. Please take it slowly. First, start by reducing your dosage before you then get off your medications. Okay. So that you don't have a rebound. And sometimes when you have that rebound, it's even worse than before. Okay. So I hope I've been able to answer your question, Counselor Funmi Adeboye. Right now, mine is 152/97. So that means that you are in grade 1. And in your grade 1, some of you in grade 1 are already on medications, but the way to go about your grade 1 is first looking at your stress, your diet, your exercise, lifestyle modifications, really. Okay. What does it mean for you to have hand shaking, especially when you try to pick something? It happens more in one hand. How often do you have these handshakes, Mrs. Edith? And how long also does it last? Charity says, what's the step to take when any side of the heart is enlarged? Okay, if you have an enlarged heart, the steps to take are usually via medications, okay? And also reducing your blood pressure. So what you are already doing right now as a hypertensive patient, but you would need to go on some extra medications to help that enlarged heart, okay? Sometimes people may need surgery. It depends. It depends on what exactly is the problem, okay? Sometimes it's not your heart that's the problem. Sometimes it's edema in your lungs. Sometimes it's actually water in your heart, okay? So depending on what the problem is, you would need either medications or you would need to go under the knife. That's having a surgery. And also you reducing your blood pressure would count as well. Okay, so that you don't have that high force moving between your blood vessel. Okay. Okay, Mr. Paul says, what if pulse rate is below 59? Any effects? No, there shouldn't be any effects or negative effect if your pulse rate is below 59. Okay. Chama says, thank you. Yes, there would be a replay, definitely. Okay. Yes, Mrs. Edith, but I'm asking, how often do you have these handshakes and how long does it last? Also, do you experience things that are unusual when your hand starts to shake like that? Because it could be something as little as you having low energy. Okay. So that's why I'm asking these questions. Most times when I wake up, my BP would be causing headache. Okay. Remember I mentioned that when you lie down and when you wake up in the morning, your BP can fluctuate. Okay. So when you wake up in the morning, you tend to have a higher blood pressure than when you are asleep. Okay. This is because of so many reasons. Sometimes it's high cortisol levels that will cause your BP to rise. Sometimes it's also your BP, your blood just trying to move against gravity, fighting against friction. Okay. So if your BP rises in the morning when you wake up from sleep, it's not a problem. Okay. And your headache as well, if it's not severe, then you are okay. Just make sure that you are not lightheaded. So try as much as possible to relax when you wake up in the morning. Don't wake up and then you are trying to do heaven and earth. Okay, first thing in the morning. So when you do wake up, try to relax yourself. Don't just jump out of bed. Okay. Sometimes when I feel lightheaded, it's because I woke up in with force, if I should say. Okay. So try not to be lightheaded, take in water. Okay. Just make sure that you are not allow your body clock to notice that you are actually awake at that time. Okay. Because your BP, yes, so many people experience an increase in blood pressure when they wake up in the morning. It's not something that would cause you harm. Okay. And your headaches as well, if they are not severe, then please just take water first and try to rest before you reach out for Panadol or paracetamol. Okay. Counselor, for me, something to support you, like what? Like your supplements, like your wellness supplements to support you, especially if you are in that stage of getting off your BP medications, okay, to keep your blood pressure in check while you are not using your meds. So some people usually do, so many of you are on your wellness supplements and so many of you react differently. So some people don't even take antihypertensive medications anymore. Some of you are just using your supplements and I'm happy that it's sustaining you. And some of you take your BP meds and your supplements together. Some of you go one day on your drugs, one day on your supplements, however it works for you. When you are in that stage of getting off your medications, because it's a very long process to get off your medications, okay? And I don't want you to have a rebound. So when you are in that stage of not using your medications as regularly, it's best that you have something to support you, okay? Just to keep your blood pressure in check. All right. So you don't have a spike in your blood pressure, especially when you are outside and you won't be checking your readings. Okay. I hope that you understand me, ma. Is 135/90 a reading to worry about? No. No. If you want to get it lower, no problem. Okay. But 135/90, you are in a normal stage. Definitely it can go lower. Okay. With sleep, it can definitely go lower, but it's not something that you should be worried about. Okay. Okay, Mrs. Edith, I think you have the answer to your question. It says it doesn't happen often when you are anxious or when you are upset. So you having that handshake is just your sympathetic nervous system trying to do its job. Okay, so please try to calm down. When you calm down, do you still experience that shaky hand? Pardon me. What can one do when you are feeling pains on your feet and fingers? At times you are not able to fold your hands. Can you tell me at what instance are you not able to fold your hands? Or at what instant do you feel pains in your feet? Before I answer this question. Counselor for me. Wow, I haven't had this many questions in a while. Mr. Paul says, can you help us review number 9? Number 9. Can you still see my screen? Number 9. The signs, number 9. Mr. Paul, are you referring to this one? And it says, can I skip my drugs because my reading has been 117 to 124? Okay, I've answered this question of skipping your medications. That's a conversation between you and your doctor, or getting off your medications. But however, I've told you how to go about it. Okay, I would recommend that you fully stop. You can reduce your dosage. Okay, especially when you don't have something to support you. Okay. All right. Any more questions? Okay, Mrs. Edith, I can see your text now. It says it's been happening. It's kind of constant. This is second month now, getting on to the third. Is it something that worries you? You having that shaky hand? And does it only come when you are anxious? Okay, I can see readings like 145, 80, 150, 110. So we'll please look at your charts. Okay, but before I move backward, Mr. Paul, I don't know if you're still here. Okay, you asked me to review number 9. I think it's this one. So I was saying that you having dizziness, confusion, anxiety can be as a result of low oxygen due to high blood pressure. Okay, sorry, low oxygen due to low blood pressure. Okay, so when you have a lower blood pressure and blood is trying to get oxygenated, through your lungs, sometimes because of either a pulmonary edema or an enlarged heart, you wouldn't have enough oxygen attached to your blood or enough oxygen to oxygenate your blood. Okay, and when that's poorly oxygenated blood, tries to move through your entire body system, and try to supply blood and nutrients to where it's supposed to, because you have a low oxygen level, it's going to cause you to be dizzy. Okay, and sometimes it would also cause you to be anxious. Now, if the reverse happens and your heart is trying to pump more blood than it's supposed to, but because there is an obstruction somewhere and you have like water in your lungs, or you have an enlarged heart and your heart is doing a lot more work, so there's very high pressure, but blood is not being oxygenated as it should, then it would cause you to be anxious or to be dizzy. Okay. And I also explained pulmonary hypertension, which is everything I just talked about right now. And I also talked about your TIA, that is your facial drooping, you having weakness. Those are basically signs of your stroke. Okay. And a TIA is like a warning for your stroke. Okay. So if you do experience any of these things, or you feel nauseous, or you want to vomit, coupled with all of these symptoms that I already explained here, then it's something that you should see your doctor about. Okay. So that you can check it out and, stop that from happening again. So low energy. Okay. Low energy that will cause you to be dizzy, to be lightheaded, and low oxygen. Okay, not low energy. Low oxygen that will cause you to be dizzy or anxious. And also when you have high blood pressure, that will be due to pulmonary hypertension. Okay, that will cause you to be dizzy, confused, or anxious. Okay. I hope that I have explained that to your understanding. So for those of you asking for your readings, please look at these charts, okay? They are going to help you. Remember that everything in slide 1 is a normal reading, okay? And this is where you have the problem, okay? Starting from your grade 1 to grade 3. That's where you have the issue, okay? I have another meeting to attend, and I have to be there by 8, and it's already 4 minutes past 8. So I really, really, really have to go. Mrs. Edith, please take my number and call me. Okay, please call me tomorrow, Mrs. Edith, so we can talk about your shaky hands. Okay. And Mr. Paul, is lower than 80 always good or bad? Lower than 80 can be good for you. Okay. Lower than 80 is actually an optimal BP reading. Okay. I hope that you are referring to your diastolic. Okay. I don't think Mr. Paul is here anymore. But I really, really have to go. I'm so sorry. I didn't know that we'd have this many questions at a time. But if I didn't reply to your question, please message me. Okay. I'm so sorry, but I have to leave now. Okay. Thank you so much. Mrs. Edith, you can call me from 9 o'clock is fine. 9 a.m. is fine tomorrow morning. Okay. You're welcome. So I would spend some more time with you later on in our next session by the grace of God. And you can also call me and speak to me anytime. You can also text me on the group too. You can ask me your questions on the group too. I would reply to them. Okay. So take care, everyone. Please take care of yourself. Take care of your health. Stay healthy. Bye.